Stem cell therapy is growing in popularity. There are claims that using stem cells to treat a variety of ailments produces amazing, even miraculous results. So I decided to look into the use of stem cell therapy locally and talk to people that have had the procedure done on them. Now, word of warning to those a little squeamish about needles: to effectively explain this procedure, there are a couple of still pictures showing a patient with a needle in their skin. 7 years ago, Ed Gulbranson began walking for 30 minutes on the treadmill every morning. His doctor at that time said it was important for him to do for his circulation after he got blood clots in his leg.
About 3 or 4 months before the end of the year, my knees got so bad that I couldn't do it. And that was a concern to me because it was causing other problems.
Gulbranson was looking at knee replacement surgery, but then a doctor recommended he try stem cell therapy first. He did.
And now I'm able to walk again. I'm able to kneel. I couldn't put any pressure on my knees when I knelt down, but now I can. Wow. So yeah, it's been great.
A lot of promise with stem cell regeneration?
Yeah, I think it's a real exciting movement. It's got a lot of potential for the future as well as for now.
Dr. Gary Walker performed the stem cell therapy on Gulbranson. Gary and his brother Eric both trained at the Mayo Clinic and are specialists in physical medicine and rehabilitation. They're excited about the use of stem cell therapy.
Well, the whole excitement of this whole regenerative movement is simply trying to do things for patients that are either assist the body or initiate the body's healing reaction. And so these are methods to try to avoid surgery, trying to get patients off of medications, and trying to find alternative ways to truly help the body help itself.
Now, so you can see right here, he's got a partial rotator cuff tear.
Dr. Walker knows what he's talking about from personal experience. He has arthritic knees that would typically require a knee replacement.
3.5 years ago for my knees, I actually had injections done then. In fact, at the time I was getting ready to do knee replacement surgery, and I went ahead and had a colleague of mine do injections into my knee, and I went from having a hard time mowing my own lawn to literally being able to walk now 10, 12 miles on flat ground without too much difficulty at all.
Earlier this year, Walker had his brother Eric do stem cell therapy on him for his shoulders and to redo his knees. Eric explains how it was done.
So it's a fairly simple procedure. However, we just place a needle in the skin and numb up an area, and then take a little bit larger needle, make a little poke in the skin, and put this needle in and just kind of go back and forth and pull off some of the fat tissue. It truly is a liposuction type of technique, though this is not looked upon as a cosmetic procedure. We don't extract enough fat to probably make a big difference. And then take that tissue and process it in such a way that we're able to extract some of the cells that are in that fat tissue that help our body to heal itself.
Gary explains how those stem cells from fat were injected into his knee.
If it's knee arthritis, we might come in straight through the knee and literally lay the needle into that joint that's arthritic and inject the solution into there.
With some ailments, stem cell therapy may resolve the problem. In others, it's a shorter-term solution.
For me, at my age, if I could even prolong having a knee replacement for another 5 years or 10 years, then that puts me out further as far as having to have a repeat knee replacement in the future or vision.
Whether it solves the problem forever or just buys a few years' time, people like Ed Gulbranson are just happy to find some relief through stem cells.
Enjoy hiking and doing the things that I love. I love the outdoors, and I couldn't do those things anymore. And so this is bringing a greater joy and happiness for me and for my family.
Quite amazing, Harold. So the bottom line here is that for some, the results are phenomenal. For the others, less dramatic, but it's a lot less than surgery in terms of cost.
So would our insurance cover that?
You know, insurance does not cover it because it's considered experimental at this point.
Okay.
But studies have found, that I found on the internet, say that in the United States, a stem cell injection generally on the knee is around $3,000 to $5,000.
Okay.
Whereas a knee replacement surgery is around $50,000 on average. So it's a lot less.
What's their number?
Oh, I'll have put it on our website.
Okay, all right, all right.
Yeah.